are now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Evert.
Hello, everybody, and thank you for tuning in to episode number 60 of Extracting Wisdom. I am your host, Brandon Evert. And over the next few episodes, I am going to be sharing what my experience has been like transitioning from the simulation clinic to live patient care, as well as sharing some tips and tricks that have worked for me to make patient care easier, more efficient, and more productive for both you and your patients. So this episode is going to be focused on patient scheduling. So we're going to discuss how to call patients, how to schedule them, and how to keep your schedule full and reduce the number of no-shows that you have. So let's go ahead and get into it. So when you first enter patient care, most likely the majority of your initial patient base are going to be current patients that have been passed down from older students. And this can be pretty confusing because you know nothing about these patients, but you are expected to not skip a beat and continue with their care. And this brings me to my first point, and it may seem obvious, but read through the patient's chart and understand the treatments they need and why they need them. So go ahead and take a look at their radiographs, their perio chart, their med history, treatment plans, and whatever else is available. And if something doesn't make sense to you and you're not quite understanding the treatment plan, most likely that patient's going to be overdue for a cleaning or a POE, and a POE for you dental students out there is a periodic oral evaluation, which is just your normal dental checkup, if you will. So bring that patient in for a POE or a cleaning, and you can also at that same appointment take a look inside the mouth and see what's going on and make sure that the treatment plan now makes sense and that you're on the same page as your patient. So back to making phone calls now. You've read through your patient chart and have figured out what procedure you need to schedule. Well, now it's time to call. And I would highly recommend that you write out a phone script for yourself at the beginning so you know exactly what to say. And I would create a script for when the patient answers the phone and also one for when you need to leave a message. You could even take this a step further and create a script for different scenarios like post-op calls, no-show appointments, appointment reminders, and so on. And I really like these scripts because all you have to do is follow it. And it's also going to allow you to sound more confident when it comes to patient care. And confidence is key. You're going to hear me bring this up over and over again a lot over the next few episodes because I think it's so important. And most likely the phone call you are going to make to this patient is going to be your first interaction with them. And you want to make a great first impression and put the patient at ease and let them know that they are in good hands. Confident hands, okay? So most likely you're going to have to go off script at times, right? This is pretty obvious because you're going to have to answer patient questions and address their concerns. But just because you have to go off script doesn't mean you can't be prepared. Always try to be by a computer when you call patients or try to get in front of one quickly when they call you because you're going to want to have their chart pulled up, their odontogram, treatment plan, scheduler. You want to have all of that up and available in order to answer any questions and schedule patients with ease. Now, let's talk about scheduling now because it is a little bit more complicated in dental school than it is in, say, a private practice. Because basically you're competing with 100 or so other dental students for chairs. And these chairs fill up fast. Like right now, at the time of recording this, it's October 19th, and I am already booked out for like the next month. So if a patient calls and wants to see me and make an appointment, I can't see them for a whole month, unless it's an emergency, obviously, and then they can be seen sooner. So my first piece of advice would be to schedule your patients sooner rather than later. It's going to be nerve-wracking and you're going to feel anxious getting all of these patients assigned to you right off the bat. And I understand that, but don't wait to call your patients once they get assigned to you, okay? Because the longer you wait, the greater the chance that other dental students are also calling their patients and booking chairs and basically taking chairs away from you. So don't wait on that. And I understand calling patient after patient gets exhausting, especially right at the start of patient care. So how can we make this easier on ourselves? To make scheduling easier, before you let a patient go after an appointment, make sure you schedule their next appointment right then and there. And that's going to be a common theme throughout patient care. And this even can translate into private practice as well. It's so much better to do things, whether it's scheduling or if you have extra time to do a procedure, do it right then and there. Because if you let a patient go and tell them, oh, I'll call you later or whatever, so many other variables and factors are going to come into play. And patients might not follow through with the appointment that they wanted to make, and so forth. Okay, so it's better to schedule things beforehand and schedule them before they leave your chair. Okay, so bottom line, don't tell them that you will call them and set up their next appointment. I mean, sometimes you're going to have to do this if the patient doesn't know when they're available, but it makes it a heck of a lot easier if the patient leaves your chair knowing when their next appointment is, so they can plan their schedules around their dental visit rather than scheduling their dental visit around their plans. And another great strategy for scheduling is scheduling multiple appointments at a time. So for example, if a patient needs 4 quads of SRP, schedule those 2 or 3 appointments that are necessary to complete that right then and there at the end of that initial appointment. Because with the competitive nature of scheduling in dental school, this is a great way to ensure that you have a chair. And I know this seems like a simple concept, and it is, but you just have to keep this in mind when it comes to scheduling your patients, because you don't want to have to wait another month for a patient to come and finish that last quad of SRP, right? You want to finish all of those SRP and those prophies and those cleanings and get all of that done so you can get onto the restorative work. So make sure you plan that ahead of time. Now, let's switch gears a little bit and talk about how to make sure your patients show up and how to increase the likelihood that patients will show up and how to keep your schedule full. Now, there are going to be patients who don't show up, no matter what you do, okay? You're not going to get 100% attendance. That's just how dental school goes and how life goes. But I do have a few tips for you to help increase the likelihood of that patient making it to your chair, okay? And the first tip is to get business cards. You can put your name and phone number on there as well as your school's information and design it however you like. And it's a very professional thing to have a business card. But the trick here, or the key to this, is that on the back of the business card, it should say something like your next appointment is, and then have a date and a time. That way, your patients physically have something to take with them to remind them of when their next appointment is. A lot of patients will go home and actually stick your business card on the fridge or something so they don't forget their next appointment. This can be a helpful reminder. Now, the second tip is to tell your patients that you are busy, okay? And this is obviously 100% true. But when you are scheduling patients, make sure they get a good look of your schedule or an Axiom so they can see just how full your schedule is. And tell them, when you're trying to schedule the next appointment, say, oh man, I'm pretty booked up. And the soonest I can get you in is on this date and time. And I think this really sets the expectation that you are not waiting around for patients to come see you whenever they want to or whenever they're ready. Patients need to make their appointments with you and stick to them. Now, tip number 3. The 24-hour reminder. Always try to give your patients a call 24 hours before their appointment to remind them and make sure that they are able to come. This really helps because sometimes you'll call a patient and they've forgotten all about their appointment. But since you called them a day before and they now have your business card on their fridge and they've seen how busy you are and understand how busy of a schedule that you have, they're really going to make more of an effort to show up the next day for their appointment. Okay, so this is a really important call. And it really helps ensure that your schedule stays full. There will be times when your schedule deteriorates a little bit and patients cancel the day before or they cancel the day of. And this can be frustrating because now you have a chair booked, but no patient to sit in it. Okay, and here's a great little trick to fill up that chair. And I like to call this your on-deck patient list or your standby patient list. And this is a list that consists of your highly motivated patients that either live close by to the college or have expressed interest in getting their work done as soon as possible and have a high likelihood of filling your empty chair on short notice. So as soon as you get a cancellation, you can try calling these highly motivated patients and see if you can get a short notice fill in order to fill that empty chair or that empty slot in your schedule. And this is a great way to keep your schedule full because in dental school, you have to have a certain amount of credits in a certain number of procedures or RVUs, depending on what your school calls them. But the key to getting these credits, and you're graded on this, the key to getting these credits is to make sure your patients show up. So really try to make an effort to apply some of these into your everyday practice. It's really going to help keep your schedule full and really sort of train your patients or get your patients in a routine of coming to see you and sticking to their appointments. So that's really all I had for this episode. I know it was on the shorter side, but hopefully that makes this a little bit easier to listen to. Live patient care is more than just good dentistry. It's also how you interact and form relationships with your patients and how efficiently you can manage them. So in the next episode, I think we're going to dive a little bit deeper on how to speak to patients properly and form great working relationships with them. And if you are a dental student or a dentist and have additional tips and tricks when it comes to scheduling patients, please send me an email at Bevert, which is BEVERT.dental@gmail.com, or find me on Instagram at Bevert.DMD, and send me a message. Let me know what things you've learned and what tips and tricks work for you. And I am always happy to talk dentistry and learn from all of you. And one last thing, if you're listening to this episode on iTunes, Spotify, YouTube, go ahead and give it a like or 5 stars if you really found this episode helpful. I'd really appreciate that. So that's going to do it for me for this episode. Thank you so much for listening and tuning in. I'll talk to you in the next one. Take care.